happy to have you here. I'm Victoria. This is Joelle. We're both co-founders of Five. And I'd love to just share a little bit before we get into this amazing topic on what Five is. For some of you, it might be your first time joining us. We'd love to give a little bit of context. So our mission at Five is to help shepherd 5-MeO-DMT into the world in a safe and effective manner, starting with a centralized hub for resources and education on 5-MeO-DMT and by engaging in research and drug discovery. Our website includes over 30 pages of free information on 5-MeO-DMT, including integration specialists, informational webinars like this one, scientific research, and more. And in addition, Five is known as the gold standard of 5-MeO-DMT trainings, offering the highest standard of education for both facilitators and integration specialists. Today, we're going to be talking about combining 5-MeO-DMT and Ibogaine, which is a pretty big topic in the space right now. And we're lucky to have some incredible speakers with us. And I'm going to share their bios with you now. So we have Laura Shapiro. Laura Shapiro is a leading expert on Ibogaine and addiction recovery. After nearly 2 decades of opiate addiction, she found life-changing healing through Ibogaine, inspiring her to help others. She is the CEO and founder of Base, a deeply personal mission dedicated to facilitating healing on a larger scale. With Base, she has created a new standard in Ibogaine treatment, prioritizing proper care, medical support, holistic modalities, integration, and meticulous attention to detail, offering a 5-star boutique experience. Driven by her passion to support individuals on the recovery journey, Laura considers it an honor to share this vision with the world alongside her gifted team. We have Dr. Deborah C. Mash. Miami-based Deborah Mash is a neuroscientist and pharmacologist. She was the first to conduct clinical studies of Ibogaine for substance use disorders, and her laboratory identified noribogaine as a pharmacologically active metabolite. Mash is the co-founder of DemeRx Inc., a clinical stage drug development company currently advancing noribogaine, the active metabolite of Ibogaine, for the treatment of alcohol use disorder and opioid dependence. Mash received her PhD in pharmacology from the University of Miami, Leonard M. Miller School of Medicine. She completed a fellowship in neurology and neuroanatomy at Beth Israel Hospital, Harvard Medical School. She is nationally recognized as a leading researcher in the field of addiction, neurobiology, genomics, and psychedelic medicine, playing a pivotal role in over 300 published studies. She is professor Emerita of Neurology and Molecular and Cellular Pharmacology, University of Miami School of Medicine. And then Joelle. So those who don't know who Joelle is the founder of Cavallia Ventures, Inc., an ecosystem for discovering the unique potentials of 5-MeO-DMT, the world's most powerful psychedelic. Joelle and his team collaborate with some of the top universities and researchers in the world, executing groundbreaking studies to understand the neurological outcomes of this molecule. KVI is the parent company to Tandava, Five Education, and Five Discovery. Together, the subsidiaries cover integrative retreats, training and education, and drug discovery and development. KVI's mission is to shepherd 5-MeO-DMT into the world in a safe and effective way. So thank you all for joining us here. We're really, really happy to have you and to dive into this really important topic right now. Before we do, I'm going to just hand over the mic to Joelle to share a little bit about some rules for the webinar.
All right, our regular disclaimer, everybody. Five is focused on providing the world with resources to educate, inform, and promote harm reduction. The content of this webinar has not been evaluated by the FDA. 5-MeO-DMT, nor Ibogaine, should not be used to diagnose, treat, cure, or prevent any disease or condition. Five does not endorse, promote the use of 5-MeO-DMT and does not encourage or condone any illegal activities. You are solely responsible for understanding and complying with all laws that may be applicable to you. All right. And just before we get in, webinar rules or webinar structure, we'll be doing a little bit of kind of moderated panel. Victoria will be moderating, and there will be a Q&A at the end. So if you have questions, please type them into the questions section, and we will get to them towards the end.
All right. Well, now that we have all that fun stuff out of the way, why we're here, talking about, the combination of 5-MeO-DMT and Ibogaine. For some of us, we may know what's going on. And I think for other of us, this is maybe a more newer topic. So I think it could be good to give some context to our audience of what's actually happening. So our first question is really just open-ended. Why has Ibogaine recently exploded in popularity? And how did 5-MeO-DMT get added to the fold?
Deborah, you want to take that one?
I think we first, I'm assuming that many of the people that have joined know what Ibogaine is, but Ibogaine is an investigational medicinal product that has over 150 years of ethnobotany and ethnopharmacology behind it. 5-methoxy-DMT goes back, Joelle will probably comment on this, 1,000 years to tribes in South America that used psychoactive snuff. So both of these molecules from Mother Nature have been around for a very, very long time. Recently, with the psychedelic renaissance, we have a new information that's coming forward because these medicines now are actually making their way into clinical trials. And this is a first in a long time, because even though, for example, I was given permission to test Ibogaine with FDA permission to do so, we were never able to advance completely to bring that molecule as an authorized and regulated medicine for human use. So here we are today, in the middle of the psychedelic renaissance, when many of the molecules are getting breakthrough designation. Indeed, 5-methoxy-DMT has breakthrough designation and being advanced in the clinic by Atai Beckley. And very important new and exciting data are coming forward on this front. At the same time, Texas and the Texas Ibogaine Initiative, because of the important information from our veterans who've gone offshore, are again advancing the beneficial effects and enduring effects of Ibogaine. But somehow in the course of all of this, there were several clinics and several groups that decided that it would be beneficial, without any clinical investigation or any information available that I know of, and I read the literature, that this was an appropriate combination of use. There were no therapeutic protocols, but somewhere it became a combined use procedure by certain centers. And we can get into more of that later in the conversation. But that's the backdrop. Now, we'll go to the two clinics and let them share more on this topic, but it's important to state here from the outset that there are no clinical data sets, unlike Ibogaine and unlike 5-methoxy-DMT. There are no data sets that inform safety of this combination of use. There's no information from the few publications that have made their way into the peer-reviewed literature, and we can get in the weeds on that, more detail, that has any information on adverse events. So people are being told, patients are being encouraged and told that this is a procedure that has validity, when I would state unequivocally here today, it does not.
Thank you, Dr. Mash. Joelle, Laura, either of you want to comment on this?
Yeah, I mean, I've been working with Ibogaine for 19 years now. This medicine saved my life, and Ibogaine in and of itself is such a profound experience, and I think it's really important too that each of these medicines really have their own container, right? Like different preparation and processing integration goes into each medicine, and I think like what I'm seeing a lot these days is it's lumped together and it's not actually separated. And I'm even hearing that a lot of clients are going to different centers with Ibogaine, not knowing that 5 is even going to be given. And it becomes like a peer pressure or people pay more money for the five, and it isn't like an intention or a medical need going into it. And it's just getting concerning of how these are lumped together, because each of these medicines are so profound in their own way, and they each need different levels of preparation, integration, support, true one-on-one care. And it can be extremely destabilizing, especially when a patient doesn't know going in that this is the model that they're walking into. And so that's my concern right now. Yeah.
Absolutely.
Joelle, you wanna?
Yeah. So, I am a founder of Tandava down in Tepoztlan, Mexico, along with Victoria here. And Tandava, was the first above ground center for 5-MeO. And, we'd been holding retreats with this medicine for quite a long time. I was one of the first people holding retreats in Jamaica back in the 2010s with psychedelics. And I think it's a very important element to simply point out and name that the model under which psychedelics are being sought out now in the majority is very different from how they were sought out over a decade ago. And so all of these medicines that come from backgrounds and cultures, that observe animistic views and cosmologies that incorporate these medicine experiences, this is something very different than using Ibogaine for addiction or using 5-MeO DMT for treatment-resistant depression. This is working with Westerners that do not already have an embedded sense of resilience in their cosmology to hold traumatic incidences and fluctuations of life. And so a lot of our work at 5-MeO has been, I think, collaboratively admitting that we're all babies in this. Using these medicines for healing is a newer concept, relatively speaking. And the protocols that we need to use are so different and need to evolve with what we're seeing in participants. And so just as Dr. Mash was saying, there is just not a lot of data. There is just not a lot of information out there. This is still a young field, relatively speaking. And to cavalierly combine the world's two most powerful psychedelics can have ramifications that a lot of people are not prepared for. And I think a lot of clinical teams are not prepared to safely and effectively hold space for that.
Yeah, absolutely. And what we've been seeing all across the board are these centers that are starting to combine the two of these medicines. And it's really interesting when we look at it, because oftentimes it's just quite a short container to put these two medicines together with 5-MeO DMT right at the end. So I'd love to hear what your thoughts are, everybody, on that.
Yeah, I mean, I'm hearing like some of the times it's combined the next day, right? And it's Ibogaine is I mean, they're so different, the medicines, right? Like Ibogaine is really this like deep reset about like reparenting the nervous system and like really coming home to yourself. And it feels like your operating system is like updating. And so for me and for Basse, it's really important that we nurture that, right? It's more of a pause and like a deep integration period, not stepping into another substance the next day, which just like it escalates the system, right? Which can be extremely destabilizing. I mean, Ibogaine, you're cracked open, you're tender, you're processing, right? Like deep trauma. Ibogaine gives you like this 3,000-foot aerial view, a full life review, where you're able to really identify how and why things have unfolded in a specific way. Like after Ibogaine treatment, for me, it's all about like lavender tea and nervines and coming home to yourself and rest and melatonin and massages and somatic therapy to really help you process, integrate, and like come home to your nervous system in a different way, not step into another huge experience that can be completely destabilizing. So, yeah.
And what is your brain doing? Let's talk about that. Why don't we talk about the nervous system and talk about what we know about the functional changes that are ongoing in your brain? The reason that the mental health and neuropsychiatry is so excited about the benefits of psychedelic medicines, and the benefits of psychedelic medicines are known. I mean, patients tell us this. They're being observed in structured clinical trials. they bring about rapid mental health improvements, significant reductions. You could block withdrawals with a single dose of Ibogaine, single dose of Ibogaine. And you can block years of abuse of hard drugs. People who suffer with symptoms of PTSD, treatment-resistant depression, non-responsive to a variety of approved antidepressant medicines, are then given 5 and completely reverse serious debilitating depression. What is going on in the brain? Well, what is going on in the brain? We don't even begin to completely know the answer. We're just beginning to scratch the surface. But what we do know is that these drugs turn on windows of neuroplasticity in the brain. What does that mean? They set up a cascade of neurochemical reorganization in the brain involving multiple neurotransmitter systems. So you've got an opening window of plasticity with Ibogaine, which according to expert investigators at Stanford and Johns Hopkins stays open for a very long time. And you've got that window open and you come in with a second very powerful, the God molecule, the 5, and completely disorganize, because there's a new publication out from collaborators, some of the best investigators in the field of EEG and neuroimaging, who collaborating with Joel's center, have published a seminal paper on this that demonstrate the kind of disruptive EEG signaling that goes out while patients are under the effects of the 5. We don't begin to know how that plays together. We don't know if some patients will be set up for a destabilizing effect that can have long-term bad outcomes for patients, or, as others have suggested, they're synergistic. There is no evidence to suggest at this time that they are synergistic. We simply do not know, because we don't even know exactly, no one's done the studies to characterize all the effects of 5 versus all the effects of Ibogaine, and then to be able to have treatment arms where you look at combination of use versus the individual groups. There are no data. So this is Russian roulette for a patient. Mm-hmm. All right? And you're not to say that if you're an Ibogaine patient, that you cannot do the 5 later on. Once you're, for example, let me give you a clinical scenario. You're a patient who is severely addicted to opioids. You have tried the standard of care, you've gone into detox many times, and you've given up, okay? You make your way into an Ibogaine clinic like Basset, where they stabilize you and prepare you for detoxifying from today, fentanyl, and who knows, a host of fentanyl analogs, xylazine, and a few other molecules, throw on some benzodiazepines, the Xanax and Ativan and whatnot. So now you're coming off of 3 drugs, all right? You need stabilization, you need preparation, you need to set your intention for why this is going to be different this time. And then you need to go under full medical monitor and be detoxified. And then, as Laura described beautifully, you need to take that, the gifts of the Iboga and start to rewrite your narrative. What's going to be different this time for me? Now, months later, down the road, you're clean, you're sober, you're talking to your therapist, and you're looking at what got you into the deep, dark addiction hole to begin with. And it turns out that you suffer from treatment-resistant depression, okay? And the SSRIs that you were given by your clinician, your doctor, your well-meaning doctor, that was the tools that he or she had in the toolbox. You were prescribed SSRIs but they didn't work for you. So you find that first dose of Oxycontin or whatever, and all of a sudden you feel normal, and there you are on that slippery slope. Well, now you have the opportunity, perhaps, to take the 5 months after you've done Ibogaine, and you've worked with your therapist and people around you, and you're now set for a safe use of 5 in a qualified center. Because in the next few months or years, we're not going to have it approved by A-type ECLI. Hopefully they're on fast track, and this will become available to patients. But right now, your only choice is to go to a qualified center. But that's one example of what patients can do. Do you have a comment, Joel, on that?
You know, really that you're kind of right on the head there in terms of the neurological aspect, because I think the neurological component is one of the things that makes both of these medicines so interesting. And they do work in very, very different ways. And the subjective experience is vastly different, where with Iboga or Ibogaine, this is a long, very subjective, very introspective journey. And with 5-MeO, we're talking about a matter of minutes with an ineffable experience that we may not even be able to remember. And the way that that impacts the nervous system is very different. They both, on their own, are very profound neurologically speaking. And yes, both have beautiful openings of neuroplasticity, critical learning period window reopening. However, just like was just said, together, we don't have really any information to say that this is safe. And also, because they are so different subjectively, you know, it can be not too difficult to have a very long subjective journey in Iboga and then just have everything get scrambled by the mega bomb of cathartic release that maybe I'm working into the deep layer of my addiction on Iboga. Maybe I'm really getting in there to some root causes. And then I go on and I'm feeling great when I come out of it. Then I go into some 5-MeO and it hits a deeper, even deeper layer in epigenetic memory or something like this and just scrambles the gentle state that I'm in and the beautiful progress that I've just made. And so, I'm sure we'll speak about it shortly, but we have had, quite a few people come to us who have been destabilized or scrambled, from this combination for those reasons.
Joel, I'm wondering if you
And
want to just speak really quickly too, because I don't want to miss this. I actually want to double click on it. The containers being so short, because we've been hearing a lot of people coming through that, maybe they go for a 5 or 6 day container and they, sit with Ibogaine X amount of times and then 5-MeO DMT like the day before they leave. And
Yeah.
I just know for us in our protocols, that's not acceptable.
Yeah, we don't generally do a retreat with 5-MeO on its own with in less than 5 days, and that's with weeks of preparation, individual prep first, and their own personal specialist to work with for at least a month afterwards. But yeah, we hear about this combination happening in 4, 5, 6 day containers, and that's a lot. That is a lot to undergo in a very short amount of time. And I think one of the unfortunate influences of this is that shorter containers allow for more accessibility. Yes, shorter containers may not allow for more than one go with Ibogaine. A person may not be feeling that full catharsis or feeling that full glow already. And so it is my feeling that 5-MeO may be being used to give a little extra bang. So people are feeling like they got something done rather than relying on the necessary skill sets of integration specialists and therapists to work with the content that's coming up over the next days and weeks. There's this focus on trying to get people to leave feeling like they've got it done before they've left the clinic. And that's a concerning idea on its own. But yeah, a few days for more than one medicine, it's a lot. It's a lot on the nervous system. It's a lot on the psyche. It's a lot to go through. It's a lot on the body. Yeah.
Absolutely.
I'd like to
I've
hop in here for a second
please,
too. So with Bosse, like our shortest program is 1 week long. We never give Ibogaine. As soon as we give Ibogaine, it's day 4. You need proper medical testing. We're running daily EKGs, full liver panel tests, blood workup, electrolyte balancing, really like preparation, somatic therapy, really getting the client ready to go into the experience, properly preparing them, supporting them. And so like it's too much in such a short period of time. And Ibogaine's never safe to take flood doses back to back. That is not the name of the game here, right? It's helping somebody actually prepare, actually integrate, and properly administering Ibogaine. I mean, Ibogaine treatment, it's not taught in medical school, right? This needs to be administered by not just emergency trained doctors, but ACLS certified, right? To really be able to properly handle it. And also, all of our doctors at Basse are also trauma informed to be able to hold space for people's emotions, the trauma that can unearth what can come up, right? And so with Ibogaine specifically, I mean, this is why we're so blessed to have Dr. Mash as our scientific advisor at Basse, and she's my personal mentor for 19 years of, where are you learning these protocols? Right? Because this is the make it or break it. And what I'm actually hearing from a lot of clients that have been calling recently is that a lot of clinics are actually like low dosing Ibogaine because it can cause QT prolongation and different medical conditions that can arise. So I'm hearing that a lot of clinics are low dosing Ibogaine and then hitting people with 5 so they don't leave unhappy and they feel like they have an experience. And that in and of itself is extremely concerning to all of us, I think.
Plus, you're sending people home with expectations that are not going to bear out.
Exactly.
One of my, we conducted 287 Ibogaine treatments in St. Kitts in a government-approved facility above ground, exactly what Joel was describing. Saying we're here, this is what we're doing, and this is what we know, and this is what we don't know. So people came down there. We were able to collect audited data on our patients and multiple reviews of our charts, which were shared with regulatory agencies and at academic and scientific meetings, around the world. Okay, above board, all right, publications. There's no way that you take a person who's suffering from addiction and give them a boost of you've got a rapid reset now. Bye, go. No, that doesn't work. The integration, the post Ibogaine, what Laura and Joel are describing, the integration work is so important. Our own patients taught us. One of my favorite patients, who was a man who he had no veins, that he had suffered from heroin addiction his entire adult life, was on methadone maintenance, could never put it together to get off of the opiates, came to us, detoxed, changed his life around, and got a PhD and went on and lived a healthy life for many, many years. He died a few years ago from natural causes. But what he taught us was something so profound. He said, Ibogaine is the high dive of recovery. But you have to swim when you hit the water. And that's what Joel and Laura are describing here, is your ethical, moral, spiritual contract with these patients who are coming into your centers are asking you to give them the best tools to go home and to make this stick. What are we doing when Iboga is just starting to, and we've got an active metabolite, my company is working on Ibogaine's active metabolite, noribogaine. You've got all this noribogaine 2 days later when people are putting on the 5. And we know that the metabolite elevates serotonin. Are we putting people at risk for a serotonin syndrome? How is this changing up the way the neurons in the brainstem are functioning? How is this changing up the way the brain is not only neurochemically resetting, but also all that, growth and the growth factors that are turning on, which we believe is part of the therapeutic efficacy? And the answer again, we don't know.
Yeah. Thank you all. I think that people are maybe seeking out this combination because they think it's going to be more effective. And I would love to hear all of your opinions. of the effectiveness of combining the two versus getting to actually do them separately?
Nobody
I
knows.
think they should ever be combined.
You would have to, the only way to answer that, Victoria gives us, when we shouldn't be hard on Victoria. Victoria's asked the seminal question. Are they synergistic? We've got these people saying they are, but they don't know because they didn't design the study to answer that question.
Mm-hmm.
All right, now
it's not selling snake oil. You're trying to validate scientifically, and there's no research to actually do it.
well, we have individually, all right, we have data on many publications, unfortunately not the kind of, clinical trial data that we would like to have for Ibogaine, but we have an abundance of data from many case reports and other studies and patient narratives and everything else. But we also have clinical investigations where we've actually looked at adverse events, you see, and we have those and we know what they are. And we know what the cardiovascular effects of Ibogaine, we know what they are. And we've looked at blood levels of Ibogaine in the active metabolite, and we know what they are. So we're able to actually offer patients, we can say to patients, we have information to inform the safe use of Ibogaine. With the 5, to the best of my knowledge, and I'm not an expert, is very safe. Right? That doesn't have it doesn't have all the cardiovascular effects that we associate with the Ibogaine and the therapeutic, window of Ibogaine, which is more narrow. I think the 5, from my understanding, is more safe. And if you look at the clinical trial data that's coming from Atai Beckley, their data suggests that the adverse event profiles, what you would describe if you were running a good, a GCP, a good clinical practice clinical trial, you have to report these things, are mild to moderate in patients. So that's good news. That's very good news for the 5. Yeah. And it's short acting and patients recover. But we don't know, Victoria, going back to your question, about what the recovery looks like with Ibogaine alone versus perhaps sub-therapeutic dose, going back to Laura's point, a clinic that drops the dose of Ibogaine because they don't know how to safely dose it in a patient, and then they add on the 5. We don't know what that profile looks like. And the few reports that are in the so-called peer-reviewed literature don't have the adverse events reported. So those data are not collected. They're not shared with us. So again, the answer is we don't know.
Nor is drug purity or dosing, right?
Yeah. Well, often they're not. Yeah, this has been something I feel like I stand on on my soapbox here with this, is that we don't have information on the purity of the drug, and oftentimes I'm not sure that even that it's been adequately measured. Just saying, because there have been publications on that much of the product that makes its way into the clinics are not pure products, and maybe haven't been stored properly. I mean, we don't begin to know all of this. Again, they don't come with a package insert like when you get your medicines from the pharmacy, right? So it's people who are seeking out these molecules for therapeutic benefit or otherwise need to do their homework, right? They really need to make sure that they get themselves into a quality setting with therapists who know how to use these molecules and with clinicians who are well trained.
Yeah, I think that's a very important aspect. And the well-trained aspect is if there is a clinic that is serving both Ibogaine and 5-MeO, the issue is, one of the many issues is 5-MeO is so different to integrate than Ibogaine and Iboga. People do not necessarily, let's say and there are plenty of Ibogaine centers operating with a lack of, I'd say, skilled therapists and integration specialists and offering real post care. And so let's say even without that, the participant may still have somewhat of a narrative or storyline that they can follow to navigate their psyche or what's been opened up to. It's not going to be anywhere near as effective as if they had support. However, with 5-MeO, they may not even remember their experience, and it's just opened up a doorway to the deepest parts of the subconscious. And so then afterwards, they may have content from maybe even childhood or decades ago beginning to surface with no resources or understanding on what to do with it. And unfortunately, many of them, many of the people that we speak to that have had adverse events at Ibogaine centers have then gone to their psychologist or their psychiatrist, and their psychiatrist has not necessarily had a familiarity with transpersonal states of consciousness or psychedelic therapy, and instead pathologize what is coming up and attempt to fix it. They end up getting in a way worse situation at the end of the day. And so there are, again, these are new medicines, and the idea of using them for healing is new. And the idea that someone would have the understandings and skill sets on how to serve both simultaneously, safely, and effectively, I don't feel that anyone has been able to take enough time to get to master both of these medicines yet. And so, just like Dr. Mash was saying, and Laura, there's just not enough evidence or information to support that this can be safe or done well right now.
I think if even going bigger, Joel, I'm concerned just one medicine at a time with a lot of centers right now. So,
Yeah,
Yeah.
I
absolutely.
mean, this is about best practices and education here.
Yeah.
And we want to just make sure that people are educated, staying safe, and knowing, information to choose what works best for them. So,
Yeah.
yeah.
Exactly.
Mhm.
Actually, this leads perfect into a question for you, Laura. You've handled more client intake forms than possibly anybody in the space and have done this with some larger clinics as well. Can you tell me what the main concerns you're looking out for during the screening process that may be specific to Ibogaine?
I mean, it's pretty in depth, right? Like it's building out the patient profile, but obviously screening any pre-existing health conditions, heart, liver, also like stability, right? Like we want to make sure that somebody is able to receive this medicine safely. There's a lot of disqualifying factors for Ibogaine. I mean, if I'll say anybody above 45, we immediately want you to do a Holter monitor before you're even accepted into the program. We run EKGs every day at our center. We do a full liver panel test, blood workup upon arrival. Pre-screening medications. There's a lot of medications that interfere with Ibogaine, right? And that has to properly be done. Otherwise, it's not safe, right? And you can't cut corners with this. It's really making sure that it's the right fit. Also screening, especially with like drug use, right? With fentanyl, like we'll tap into that for a minute. It's not even fentanyl anymore. It's xylazine, it's this different analog, it's that different analog, right? So drug testing every day at our center, urine samples, like best practices to make sure that this can be safe because Ibogaine can be done safely. It just requires true proper medical care and attention. And that requires an on-site staff, 24-hour medical care with people that actually know what they're doing and advisors like Dr. Mash that can really help in a way to educate and form and learn, because that's the name of the game here. But we truly believe that Ibogaine can be done safely with proper screening, proper medical care, and proper attention and intention to the client's specific needs.
Yeah.
Victoria, there are inclusion-exclusion criteria for Ibogaine, precisely because the drug is cardiovascularly active, all right? Ibogaine has what we know to be a more narrow therapeutic to toxic window. So people who have taken Ibogaine in unsafe settings, again, as Laura said, with other drugs on board, you can change the pharmacokinetics of Ibogaine. Ibogaine is metabolized through the liver. It is under an enzyme that is genetically regulated. So you can be a fast, intermediate, or a slow metabolizer. Why do we care about that? We care about that because if you have other drugs, other central nervous system drugs or other medicines, maybe antibiotic, it may interfere with the metabolism. And now your blood level of Ibogaine, instead of being over in the safe zone, now is up here. And now you're not in the safe zone. So you have a clinician, so-called doctor, or person doing your intake, and they simply didn't ask you, what meds are you taking? That could put you at risk. Let me give you another example. People who use hard drugs. Okay, they get an EKG. EKG looks okay, right? Except it's not. Because the person who read the EKG doesn't really know how to read the morphology and didn't repeat the EKG, or maybe didn't even know how to get an accurate measure of the refractory period of the heart. Maybe some of these clinicians, not saying who or naming names, but maybe some of these clinicians don't even know how to do that. So we know that Ibogaine is going to cause QT prolongation. We believe it can be managed. Magnesium. All right, magnesium is important. If you've got a patient whose liver enzymes are elevated, that's a problem. You can't give that patient Ibogaine till those enzymes come down. What about their electrolytes? Their potassium, their calcium, their magnesium levels in the blood. Are they in the normal range? Did anyone check your blood to see if that's been done? Because you don't want to take Ibogaine if that hasn't been done. Okay? So these are best practices that people who are familiar, who've done their homework, who've read the publications, that have listened to, experts in the Ibogaine field talk about this, can screen patients to make sure that, just like Joel was saying, you're going to go run the track with Ibogaine. You're going to need to rest afterwards, and your body's got to be ready for you to run the track before you take the dose of Ibogaine. So these are some of the examples. Also, there's another phenomenon called long QT syndrome. These are people who may carry a genetic risk that is silent. But when they get a drug that is a QT prolonging drug, this can be unmasked. Okay? Now, in a qualified center with doctors who understand and are looking for this on the cardiac monitor, no problem. Because this can be managed, and doctors know how to manage it, and it's not going to turn life-threatening. But if you put someone in an unsafe setting with people who are not qualified, or the doctor simply isn't around, and you have a nurse who's really not an ICU nurse and doesn't know how to look at that cardiac monitor, and all of a sudden you go from a normal cardiac signal to an abnormal cardiac signal, what could that be? Ventricular problems in the heart? You're in trouble if you don't have somebody there. So that's why it's so important. We're right at the breakthrough point again to bring these medicines forward in a way that are going to make them available for a wide group of people. And every time we have one of these so-called centers, therapeutic centers, do something wrong, what does it do? Sets the whole field back. Mm-hmm. And if you have an adverse event for someone that's had Ibogaine and the 5, who's going to get the blame? Was it the 5? Was it the Iboga? Proximity is causality. What if they have hallucinogenic persisting disorder and a month later they can't function in life for some unknown reason? And that gets reported to the Poison Control Center by a clinician. Now we've got adverse event reporting going back up to the FDA and elsewhere, and that's going to put the genie back in the bottle. That's why the educational work that you are doing with 5 is so important for patients. You are actually, the custodians of this knowledge now. You have some of the largest open label information to report back to the world on how the beneficial effects and if there's something else going on, right? you're going to report it. You're transparent. You're doing it. So you have a high ethical, moral compass here in providing based on the knowledge that we have today, a safe environment to take the 5. Same thing with Basse. Basse is dedicated. Basse was formed, dedicated, a mission to give patients a safe container to take Ibogaine. How do they do that? Because they don't cut corners. Because they've got doctors there 24/7 watching you. So when you go in, when you get in the rocket ship and they launch you on Ibogaine, they've got you. All right, they got you. And I understand what that looks like because I did that in St. Kitts when we had no information, Joel. Laura knows this. We had no information. We had what Howard Lutzoff, was telling us and what we were able to see with our own eyes. And what we were able to see with our own eyes is that Ibogaine worked and it brought great benefit to patients. We saw people transform their lives. And that's exactly what Joel is seeing with Victoria and the work that they're doing. And that's again now what Laura's doing in the next generation Ibogaine clinic. So as I sit here today, I'm calling on the other clinics to step up to the plate. We have a moral and ethical responsibility to the patients and to the movement because the patients are waiting. People want access to these molecules.
Yeah. Thank you. Thank you so much. I think that this whole conversation is really important, but the educational piece on the risk factors of each medicine individually and then also combined is important for people to understand. So Joelle, I wonder if you could kind of share similarly to Laura, you've seen probably just as many screening forms for 5-MeO-DMT at some of the things that our team is looking for in terms of risk. I'm going to turn my light on. I'll be right back.
Yeah, with 5-MeO-DMT, it's a very different situation when it comes to screening and intake. Of course, there are the same, things that will be included in both. Of course, there are certain medications that are going to contraindicate with 5-MeO, though far less. There is cardiac implications, though far, far, far less. There is a notable spike to blood pressure and heart rate and constriction in the aortic valve temporarily with 5-MeO. We're looking for someone to be able to pass a stress test EKG with their cardiologist. We do have a doctor on site for these reasons. But mainly what we're really looking for and what a lot of our prep and a lot of our screening is around is, I would say, resilience in the psyche. We are looking for them to be in a stable place to have perhaps their entire world shattered. We are looking for them to be in a place to where this isn't going to send them directly into ontological shock that will spiral down in a very difficult way to manage. And so with 5-MeO, of course, there are medical concerns, and we are able to mitigate issues having a well-trained first aid staff and just a doctor on site. Again, with 5-MeO, it's a lot more around the psyche. This is the strongest, most profound, rapid experience a human being could possibly have in their whole life. And there's a lot of elements of 5-MeO-DMT that can read to a normal person like an emergency, like something where emergency protocols need to be initiated. So a lot of the screening and intake, we're also getting to understand where certain presentations may show up that we can say, okay, that's this kind of catharsis and not serotonin syndrome, perhaps. With 5-MeO-DMT, we are really looking for there needs to be an attitude of willingness. There needs to be an attitude of willingness with 5-MeO-DMT to get into the big process, to understand that this may be a very, very rough and challenging journey. However, it doesn't mean that they're doing it wrong. And actually, there was a great question in one of the comments that we'll get to later, kind of about the doing it wrong, quote unquote, aspect. But yeah, with 5-MeO, it's even though, of course, they both are around the psyche, I would say some of the biggest concerns when it comes to screening, probably with Ibogaine, is going to be the health aspect. While with 5-MeO, it's going to be much more psychological. A lot around trauma and how their trauma affects them and shows up in their life. Different disorders that may become exacerbated, things like this.
Are there any red flags that you would say you would encourage patients not to take 5 and to maybe try psilocybin or something else? And also, I wonder, do you take do you take people in who are otherwise hallucinogen naive? In
Yes,
other
we
words,
do.
have not tried other hallucinogens before.
So, actually, probably about 90% of our participants are first timers to psychedelics altogether. Many have never even smoked cannabis. We are a bit of an outlier amongst our colleagues in
I think you're an
5-MeO.
outlier.
And I think one of the main reasons here is because 5-MeO gets this reputation as the huge God molecule, big breakthrough experience. However, 5-MeO can be worked with very gently. We work with very low doses very often with a lot of participants. And in a lot of cases, it's not even going to be appropriate to bring them into a full release dose. And so 5-MeO can be a very gentle experience when intended to, but also it's important that people who are psychedelic naive, they don't have already that registration in their head of a certain level of intensity is going to bring on a gripping because, like, oh, this means I'm going too far. They've got no idea where that level is. And so we actually really love working with first timers because there isn't this preconceived notion of what too deep may be. And so it kind of allows them with the right preparation to really just slip in there. And we love to take very, very gentle approaches. We love to go very easily with our participants. And so, I'm sorry, Dr. Mash, what was the first question you would ask before the
Red
first one?
flags
Oh,
of
yes. Red flags, we would say it would not be an appropriate time for, first, I guess, medical contraindications, risk of destabilization, history of psychosis, schizophrenia, these things.
yeah, they're
Uh,
out. Right.
cluster B personality disorders are not an automatic no, but do require a lot more discussion. And then a discussion with our team, our psychiatric team as well, to determine if they feel that this process will be able to support them. Um,
So you do quite a bit of clinical phenotyping on the front end
we do,
in
we
your
do.
intake.
Yeah. We've got a really, really awesome support team. We're a really awesome support team. This is a
That's impressive, I would say.
thank you.
No,
Thank you.
I'm a critic, as you
Us
can
too.
tell. But
Us too.
to hear that, I think that's that's impressive.
It's
And
yeah,
Joel, you also do the hug, the kiss. Sorry, I wanted to jump in because
yeah,
this is impressive to me too. Because you do the kiss, the hug, and then potentially the blast off too. Can you touch on that for a second? I think it's really
yeah,
important. You're really supporting titration here, and
yeah.
that's a big piece because it helps people reclaim their agency and feel safe and comfortable and held. So.
That's another big issue. We're finding that a lot of Ibogaine clinics serving 5-MeO aren't informed on dosage protocols. And so they're kind of going with a cookie cutter approach or maybe using one kind of pen or something like this. We'd say 5-MeO dosages can be split into three categories: handshake, hug, full release, low, medium, full. And, handshake, we'd say, 1 to 3 milligrams, hug 4 to 7, full release 8 to 12 for a first timer, but upwards of 15 plus for people more experienced. And the good old handshake hug full release protocol, that comes from the OG days of the original pioneering members of the conclave, and this was kind of the initial way of titrating up, just starting off with a low dose, allowing the nervous system to regulate, allowing them to catch their breath, allowing the discomfort to come up and allowing them to get some space with it if it's there, and then going a little deeper when they're ready, when there's consent, when we can move with the natural rhythm of the process. And then, if they're ready, we can take them into that full experience. And by that time, their legs are already in the water, they're warm, they feel it, and they can go in. There's a lot of work with 5-MeO. Particularly with low dose work, is great to combine with internal family systems therapy with somatic experiencing. 5-MeO is a very versatile medicine, but when it's used out of informed care, it kind of gets used only for the big bang, with very little context or understanding of how that results in actual shift and change moving forward. But just to go back real quick, the last red flags I would say where we wouldn't take someone on with 5-MeO, let's say a mother who's just left an abusive marriage, and she's got their, 1-year-old daughter and they're living in a hotel and she doesn't know where they're going to be living next month. Probably not going to be the best time to go into this experience. We like to say, get the foundational stuff sorted first, the quote unquote root chakra stuff, where your sense of safety, where you're living, track your food, that kind of stuff. And honestly, I turn away quite a lot of people just if I detect a magic bullet seeking. There are, plenty of articles that have done a disservice to this movement, saying like a single inhalation of 5-MeO cures depression and anxiety. That's a very risky statement to put out there. And so a lot of people, unfortunately, are reaching out at the end of their rope. They've tried everything. They're ready to try this, but they just want a drug that's going to cure them. They may not be, and then I say, like, give them the rundown. They say, oh, well, do you think, instead of doing the whole thing, I can just come down there and do it, for a day and then leave? I'm on a tight schedule. I'll then give them the myriad of reasons why that's an awful idea. But then at the end of the day, they're like, okay, I guess I can come down. Like, do you think the integration afterwards is really necessary? Usually around then we'll refer them elsewhere, to some colleagues that may be able to support them with a medicine that may have less intense implications on the other side, or even just therapeutic modalities rather than a
Will you
psychedelic.
comment, Joel, on suicidality, please?
Yeah. Yeah. Suicidality, I would say with 5-MeO, if there has been active suicidality, it's going to be not necessarily a full red flag, but a huge consideration because so many people get into their heads that they're going to do a drug and then just feel great the whole time instead of do a compound that opens up to a lot of content that may have been stored for a long time. Coping mechanisms may become inflamed, defense mechanisms may go through the roof. A lot of things may become inflamed. There may be extreme ups and downs, which is why bipolar is going to be a very risky one with this. And so suicidality, there could be a very deep dip into a down state. That suicidal ideation could come back. It could even intermingle with the ontological reorientation of 5-MeO, where perhaps they've started to go into meaninglessness upon witnessing what can be considered just ineffable infinite. There's a lot of things that can come up, and so with suicidality or suicidal ideation, it's a very, very delicate one. There's very few cases we've taken on where there's been active suicidality, and it's been a private container with extra support systems, extra psychiatric care, and a lot of consent from not just the participant, but their families beforehand on what they're going into.
I think that's very, I thank you for sharing that with us. And I think that's so important for people to hear and to communicate to others. And the fact, as we are working with experimental medications, what you described, the ability to work with family support, because someone, this could be life and death for someone,
Yeah.
and this could save someone.
Mm.
But at the same time, the fact that your team goes the extra distance to ensure the continuity of care is absolutely, that's just perfect. Thank you.
Thank you. Thank you, Dr. Mash.
Yeah, and I wanna also touch on that for a second too,
Mhm.
because you take somebody that has severe trauma and is in extreme substance abuse, and a lot of that also comes with them suicidal ideation, not wanting to be here anymore, right? And so then potentially Ibogaine into 5, and it's just, why do I want to be here anymore? Like, I just met source, I want to go home. Like, I hear a lot about that from clients of like, what is the meaning now, right? I've just experienced oneness, and now I come back to my unhappy life, and how do I even integrate, right? Like with Boss A, we include like 30-day aftercare program into the treatment. It's included in the cost. It's everybody gets that support. There's an integration specialist that's also working with you afterwards, right? So you have to set people up for success. It's unethical to crack people open and then not deliver aftercare support to really make sure that they're getting the most out of this. Honestly, aftercare is about 70% of it. I mean, these substances are amazing. They provide insight, neuro reset, all of that. But the true game here is what you do when you get home, right? If you're not willing to change your life, it doesn't matter what you're taking, you're ultimately going to go back to it, right? And helping you process the trauma. I mean, with addiction, this is my opinion why conventional rehabs and detoxes don't work. It's addressing what's on the surface. Addiction's always on the surface. It's the trauma underneath. It's the addictive structures, patterns, behaviors. Left unaddressed, it will always lead back, right? So really helping you implement a new lifestyle, changing your life, having the support, care to really step out of it. Otherwise, it just becomes this rinse and repeat. It becomes this revolving door where it's more substances, more things. And in my opinion, that's where we start to approach the psychedelic all-you-can-eat buffet. And that is frightening to me, right? Less is more, and really like coming home to yourself. More is not more. Pushing people, psychotic breaks, that is not okay in this space. It's about nurturing, helping people reparent their nervous system, themselves, to really have these breakthroughs and realizations to change. With Bosse, we're women owned and women led, and we definitely bring this like supportive, nurturing, process to the clinic, to our patients, to really make them feel cared for. Lots of one-on-one attention and support, because that's what provokes change, feeling held.
Mhm.
Hey, you guys, I think, well, we're at that hour and I want to make sure we have time for questions. So just before we start taking some of the questions, just opening up space to the three of you, if there's anything that you feel you really want to share with our listeners, any advice, anything that you think people need to consider, just if there's anything else left there that you really feel needs to be expressed on this topic.
Haven't we been doing that?
But she's letting you have a last word. But I think, if I may say, I think the discussion, Victoria, you've led us on a very broad, we've covered a lot of topics. We've talked a lot about, the benefits of these medicines. And you've definitely, both centers have established themselves as, your credentials are, for me, listening to you. And, I raised a lot of things in my soliloquy and commentary, but you've impressed me. So let's get to the questions, Victoria.
Yeah, all
I
right.
learned some things. I love that. Thank you. I learned more about 5. That was great.
Mhm.
Wonderful. Okay, so I've got a question here. To my knowledge, and maybe misinformed, haven't some, if not all, panel members advised some of the Ibogaine centers and/or practitioners, some who are combining 5-MeO? Have you held a strong line, as it seems like you all are holding strong beliefs on combo during this webinar? I appreciate and agree with what has been shared today. Thank you.
Well, I think I don't know who's advising me. I have not advised all of the Ibogaine clinics out there. Please don't think that. Anybody? No, I have not. The work that we did in St. Kitts, of course, was solely with Ibogaine. And the work that I've done in a regulatory, capacity, submitting protocols before the FDA, as well as the MHRA in collaboration, work that we did with the Thai, was solely looking at the safety of Ibogaine so that we could move into phase 2 clinical trials. Yes. I have the honor of working with Basse. Basse asked me, I'm not an owner or operator. I have no conflicts of interest here at all. I'm not currently studying Ibogaine in the clinic. So, what we're trying to do is to provide, I was asked by Basse to provide, guidance to the clinicians, and to share the knowledge that I've accumulated in our studies over the past 30 years, and we do that. I have never worked with 5, and I have no knowledge of that, but I have raised questions in public and regarding the combination of use, and I've spoken not in press, but I have spoken individually about my concerns. So let that stand on the record.
Great, thank you. Okay, another question. What do you imagine the US will do with Ibogaine and 5-MeO-DMT for the upcoming trials? Will the 5-MeO-DMT be included in those trials?
Absolutely not. I can answer that. They're absolutely not. It's going to be, first of all, the question, and this is something I've talked about in public forums, is there a regulatory path forward for Ibogaine? Okay. This is what Texas is going to try to do, and other states, and what Sonera is doing, that company, although they're fairly stealth right now. We don't know all that they're doing, but these are very well qualified. This company, Sonera, is a very well qualified company to take Ibogaine forward into clinical trials. Anyone and everyone that I've spoken to, it's absolutely understood that you would not do a combined protocol. Never. Okay. And nor would the FDA allow it. I'm 100% certain of that. That simply would not get traction. That dog would not hunt. So the answer to you is that assuming that Texas goes forward, assuming that the FDA grants permission to test Ibogaine, it will be Ibogaine as the sole investigational drug.
And I can speak to 5-MeO. Currently in clinical trials, we do have Atai Beckley and GH Research, both going into phase 3 with 5-MeO, both for treatment-resistant depression and substance abuse disorder as well. And then there are a few other ones. I believe BioMind Labs, I think it was, is going into phase 2 with a sublingual formulation of 5-MeO. We are unveiling this month 5 Discovery down in the New Orleans Drug Development Conference, where we have non-hallucinogenic analogs of 5-MeO-DMT for CNS disorders and brain health. But, Beckley Atai Beckley did get breakthrough therapy designation, and there is a possibility we will see it through FDA in the next few years.
We can hope. We can hope.
Mm-hmm.
I'm betting on that horse, Joel.
Us too.
I think the combined Atai Beckley bring a lot of strength and a lot of they have excellent jockeys, and I'm betting on that horse.
Me too.
All right, I've got another one here. I'm curious to hear from others on this. I'm currently supporting someone who went to a clinic in Mexico where they received both Ibogaine and 5-MeO and were put on a plane the very next day.
No, God.
Yes. When they returned, they were very open and sensitive, having a hard time regulating sleep, mood, and even their sense of identity. There was also a strong pull to go back, some confusion about what to do with the experience, and a real search for grounding and meaning. Not long after they got home, they ended up setting up another time to return because they felt they had somehow done it wrong. I'm wondering if this is fairly common.
You shouldn't be allowed. Patients need to integrate. It's never appropriate to have conversations about a second treatment, and you need to come home to yourself in this.
But they were sent home one day after 5.
Yeah.
They were put on a plane immediately after they had Ibogaine, who knows how many days before. Then they had the 5, and then they got to go home the next day. That's unheard of.
Yeah.
Please talk about that.
The most unfortunate thing there for me is, there's a lot, but that they're feeling like they need to go back because they did it wrong. So many places are not operating in a way to where their participants are informed on the process-oriented nature of this work and are not provided the support and care to navigate those states afterwards. So people end up thinking that they're broken or that they did it wrong and they need to go back, do it again, because everyone else, it looks like, got the right effects. People that they read about in articles got the good effects. Why didn't they? Must be them. And it's a huge
good point.
Shame. Yeah.
Makes you wonder what's in the informed consent.
Yeah. Yeah.
Just saying,
Mm-hmm.
All right, I've got another one kind of along the same lines, maybe. When we're talking about combined, many places are doing Ibogaine day 1, and then on day 3 or 4 offering Bufo or 5 the same week. Are you saying not doing them on the same week or same day?
Okay, iodine should never be given on day 1. Day 1 should be arrival, EKG, liver panel test, blood workup, psych evaluation. We don't ever give ibogaine before day 4. It is not, you can't, it's unethical at that point. And no, it shouldn't be combined in our opinion. It's too much, too condensed, too soon. I mean, that can cause a schism, that can cause health issues, cardiac. I mean, it's red flags all over that.
Yeah.
If you go somewhere and they tell you that you're going to walk in the door where their doctors haven't even had a chance to get to know you, and there's no intake, forget about medical screening. There's no intake, and you're going to be given Ibogaine, take your suitcase and go out. All right, you can quote me. Get out. Tell them to give you your money back. And you can say, if you don't, I'm going to call Dr. Mash and I'm going to ask her to help me. Okay, because that is so unethical. This is a buyer beware situation, people. This is buyer beware. And, read the informed consent, ask a lot of questions, meet the clinicians, talk to them, ask them questions. All right? And don't, and exactly what Joel said, because you've listened to a podcast or you've heard someone talk on the internet and whatnot. No. You're an individual. We don't have a package insert to say these are your risks. You're unique. And whatever reason that you're seeking Ibogaine, all right, has its own set of medical intake questions.
Mm-hmm.
Just the way Joel described, very important clinical, what I call clinical phenotyping. What am I talking about? A psych eval, a very strict conversation with you about why, what's going on with you. All right. If you're not getting that from your program, question why you're there. Joel and Laura?
Yeah, I mean, that's essential. I mean, yeah.
Yeah. Yeah, for me, and I'm seeing a lot of questions in there, like kind of in here around like, okay, well, how long do you need to space them out? I think the common theme that we're hearing, today is that there is not enough evidence to support that they are safe to be served within the same retreat, at least for everybody. Yeah, Laura.
So I'm going to actually set this up and then punt this to Dr. Mash. So noribogaine. So you have a long-acting metabolite that comes in. So, I mean, even other substances, not just 5, like mushrooms, or we want you to have substantial time after Ibogaine. The noribogaine is the window of opportunity. Dr. Mash, I'm going to let you jump in on this one here. This has
there's
all over it.
Think about this. All right. Your brain. There are more neurons and neural connections in our brain than there are stars in the Milky Way galaxy. You're using a strong psychedelic. We know Ibogaine is extremely strong psychedelic. And you heard Joel say that 5 is the strongest tryptamine on the planet. Okay, each of them are going to cause changes to as I said, not only the neurochemistry, but also the wiring diagram of your brain. We do not know how long the window of neuroplasticity stays open. We assume there is some good publications on this, not in humans, but in animal models, seminal work done by investigators at Johns Hopkins, current director at UC Berkeley. Dolan, who presented, Dr. Dolan presented, incredible information. Joel described it. The critical learning period opens. That is so important. Again, I can speak to Ibogaine, as can Laura, but it's so important for the therapeutic process of Ibogaine is to get that, it's your commitment, your purity of intention, setting the intention and getting what you're going to get, the information download that you're going to get, and what your brain gives you is unique to you. Yes, there is some commonality of experience, but that window opens up. And according to Dolan, that window is open for a very long time. And if you look at her publication and look at her graphs, we don't know how long it is. We don't know. So what happens when you bring in another one that's another type of neurochemical program that's working on a different part of the brain, a different connectivity of the brain? How is that going to change the effect size, durability, and outcome for the Ibogaine? Is it going to erase a part of it? Is it synergistic? People say it's synergistic. We don't know. Is it additive? Is it beneficial? Or does it, take away from you doing the work with the Ibogaine because of the way Laura said, you got to see God and you want to go home and now you think you're rebooted and you're done. You're done here. No, you're not done here. Neurons that fire together, wire together. You got to go do the work. So, sit with the medicine. Let the medicine work. Work with your integration coaches. Learn, let the 5 teach you. You sit with 5, you learn from 5. You sit with Iboga. Actually, don't sit with Iboga. You're going to go in a medical bed and you're going to be monitored and everything like that. You're going to, lay down, put the eye shields on and your headphones. You're going to go. And it's purity of intention and go with the flow. And then do the work. Sit with the medicine for whatever period of time. I don't think that any one of us, as we sit here today, can give you an answer on how soon you should run out and do 5 after Iboga, or you should do Iboga how long after 5. I don't know, my colleagues here, maybe they have an idea.
I mean, I think
I don't.
is different too, right? With the noribogaine, it's not a set amount, it's not 2 months, right? To the day, right? And so
we don't know.
You have to, I tend to advise people like 3 months, just be with nothing else coming into that. And then having its own container, if that's the choice you make later, with the intention of, I'd like to go to Tandava. I'd like to work with 5. Let me properly prepare for this experience. Let me put myself into a container where it's all about that.
And I want to repeat, Laura, let me repeat what Joel said.
Yeah.
Joel said, if somebody comes in and says, I want to, come in, do the drug and get out, that's a flag. Yeah. And I really respect what you said here. That was the same thing with the Ibogaine clinic in St. Kitts. If, I used to say, this ain't no party, this ain't no disco, this ain't no fooling around. Here's your passport. There's the airport. You're leaving this town because you don't belong here. Yeah. All right. There's got to be some ownership.
Mm-hmm.
Yeah.
I wanted to speak to what Laura was just saying, around just giving each medicine its own space, Obviously, there are a lot, and there's people in this audience right now that have done the combination, have had success. So we're not saying, hey, this is going to mess everyone up. A lot of people are saying like, oh, hey, I had a really good effect with it. Sweet. Have you ever done a retreat that's entirely devoted to just Ibogaine or entirely devoted to just 5-MeO-DMT, where all of the aspects of that retreat are detailed towards the nuances of that particular medicine and how to hold and process the content that can arise with that medicine? I think we can have big impact when we get a big bang. However, I think we can get far greater impact, far more safety, and far more longevity with the growth and the healing that we're attaining when we have a container that is informed, is meant to go at the natural pace that you're growing at, and has taken time to master the medicine that it's offering.
Yeah, I think having its own containers are essential, right? All the medicines, I mean, they all have different properties, all have different callings, all have their time and place. But I think the biggest piece here is own container and really like it comes back to the psychedelic all you can eat buffet, right? And
Yeah.
because now these medicines are becoming more popular, more is not more. And true healing is actually
Mhm.
requires thoughtfulness, slowness to be
Exactly.
held and to really come at it with attention and intention to
Yeah.
be able to truly upgrade and change your life.
Yeah.
Right? Otherwise, the just trauma just perpetuates. There's too much risk there to perpetuate that trauma.
I wanted to just give a little more context as well. There's a lot of people coming in now that were leaving some comments that may not be aware of kind of why this whole conversation started. I did a post on LinkedIn that got a lot of traction maybe a month or two ago about this issue, and had a lot of people reach out from there saying, yes, we've been seeing the same thing. The reason why I started writing about this was because, at Five, in particular, we're the group that everyone reaches out to when they've been harmed or destabilized by a 5-MeO experience. And so we field a lot of reports from around the world of people who have had adverse experiences with 5-MeO, and particularly over the past year, and then especially over the past 6 months, we started to get a wild uptick of people reaching out in crisis after going to some of the very popular Ibogaine clinics and doing 5-MeO afterwards. And very often we're hearing the same thing, that they just weren't prepared for the 5-MeO, that they didn't know what it was going to be like, and it was treated like a little extra. And it threw them into crisis. Maybe not immediately. With two people I spoke with, it didn't happen until 3 or 4 weeks later. But that's something that can happen with 5-MeO DMT, is a very actually normal thing. And so, why we're really having this webinar is because right now, this combination is growing in popularity. And I just maybe would plainly state perhaps this combination doesn't scale to the masses as well as people may have hoped it does. This combination, the more it's being used, the more people are being hurt. So, the more people that are being served this combination, obviously, the more people that are being harmed. Does it mean everyone is being harmed by it? No, but there are an alarming amount of people being harmed from it these days. And so, yeah, I just wanted to give that context. Um, so
I
it's,
had one, I had, sometimes with the Ibogaine, when things go south, people will reach out to me for comment, or, reporters will reach out to me. The court system has reached out to me. I've given I've worked as a subject matter expert on Ibogaine. And, if I'm called in to comment on the combination, I'm going to tell what we know, which is we know nothing. But I had a phone call that came from a mental health facility, from a young woman who had been on antidepressants for a very long time, and she decided she wanted to come off antidepressants. She went to one of the main Ibogaine clinics that endorses the combined use, and she ended up in hospitalizing herself. And this was, as Joel said, many weeks afterwards, because although she came back and felt well for a few weeks, the rebound effect that she got was like nothing that I have ever heard about with Ibogaine. All right. Now, she was a unique character, and an N of one is an anecdote. All right. And we don't have all the facts about her. But the issue of us hearing stories, is why we've taken our time to be here to speak to you today.
mm,
I know we're getting close to our time here, but I see a question that I think would be great to have, Dr. Deborah Mash and Laura speak to, and then also Joelle on the Five side, because it is something that's happening. With all the locations popping up now as retreats and providers, which is a whole lot all over the place, we need to know what is a quality setting for each of these
God bless you.
medicines.
Yeah.
Ibogaine is not a retreat. Ibogaine is done in a medical setting. So I think that's first and foremost. If any Ibogaine clinic is saying that they're a retreat, run. You know?
People want to experience Iboga, right? So there are some of these Iboga retreats that have popped up. And there are underground clinics that are, not advertising, that go by word of mouth. And none of us know really what's going on there. People are desperate. People don't have money, and they will seek medicine in unsafe settings. This has gone on throughout my academic career, right? And each and every time it has set us back in moving the medicines to make them available to the largest number of people. Not everybody can come up with the money to go to Joel's center or Laura's center. All right. So we have we have that responsibility, but I think please, it's a buyer beware situation where you have to ask the right questions. And if people want to go in and, try to have a Bwiti style initiation and a retreat, don't be doing that for detox. Oh no, people die in detox. Someone asked about the recent unfortunate occurrence on the West Coast of Mexico. People will get into trouble in regular detox. So again, that's, no retreats with Iboga for people that have serious mental health disabilities or are trying to, break the cycle of addiction, I would say.
Joel, do you want to speak to quality settings in terms of 5-MeO-DMT?
With 5-MeO-DMT, if people are looking at where they may want to go for a safe and effective experience with 5-MeO, first thing you're going to want to look for is, are they providing a container or are they providing simply an experience? If prep and integration are not included as a part of the thing and you see any language like "we're here if you need us" kind of thing, run. That's a major red flag. I would say a lack of, well, a 5-MeO-DMT retreat doesn't necessarily need to be a medical setting. A lack of medical informed protocols is a major red flag for a 5-MeO. People call us overcautious. We've served enough people. We had the first 5-MeO center in the world. We've seen incidences, and our emergency protocols have had to be initiated. And we have been very glad to have had a doctor on site and medical equipment. So these things do happen. So if there are people without medical protocols, not providing integration, those are going to be the major red flags. You'll see wild ones with 5-MeO and Bufo. You'll see some wild red flags, but the main ones that you may see at a center, not like, are they going to be serving you in the middle of a park in Austin, Texas, or something like that?
I want to comment on one of our questions came in from Jennifer, who doubled down on what I said about the person who took herself into the hospital as an inpatient, and that she was familiar with someone who actually had a bad outcome similar to what I described. So again, as Joel's pointing out, he's hearing more things. Of course, they're going to come to him. Laura hears them too. We hear them, and thank all of you who took your time today to come to listen to this. And you're a citizen scientist, so I'm really proud of all of you, because you get the information out there and you can help, protect people and guide people and steer people and get help get this information out there. So, I want to thank all of you for tuning in.
Yeah, absolutely. Big thank you to everybody. And on that point, we're going to have a recording available on the 5 YouTube. We'll make a big post about it. Please share this recording with anybody in your communities that you feel like this would be supportive to really ensure that harm reduction is happening. And before we close out, we have a couple of announcements for people. We have free biweekly integration circles for 5-MeO-DMT. Our next one is on February 11th. If you want to come and join the community, we'd love to have you. Our facilitator training is open for applications, and our September cohort will be starting very, very soon. So just so you know, we only have 15 spots for that. If you're interested, please do let us know. And if you have any questions about any of that, you can send an email to info@5-meo.education. And I'm just asking how you can sign up for the integration circle. Just head over to the 5
Put the
website.
link in there.
I don't know if they can see it. Can they see the?
I'll put it right in here.
I'm not
Okay.
sure I don't know if they see it.
I don't think they see the
I
link.
think just the participants, Joel. So,
Yeah.
but go
They
to
see
the website.
They see it.
It'll
They've
be
got
on
it.
the website.
Yeah, they
You
got
guys
it.
got it.
Yeah,
Awesome. Well, we hope to see you there. And like I said, if you have any questions, reach out. The recording's going to be up soon. And thank you so much to our amazing speakers. It was so, so great having you and your wisdom, and such an important topic. Thank you so much. And thank you to everyone who joined.
Mhm.
Yeah.
Yeah. Thank you
Have a
all.
have a beautiful night, everybody.
Ciao.
Ciao.